PEs are tricky to find. It seems you'll never be right, but when it's not on your mind, that's when you miss all of the signs.
Meet Amy. She's just a little old lady who's getting close to be 80. She's almost pushing up daisies, and when she walks she feels shaky. Until one day she takes a fall cause it's rainy, and now she's stuck in her bed with her heartbeat pounding like crazy. Or maybe she's still young and she's dating, no plans of having a baby, with OCPs in the daily. But now her right leg is achy, and now her chest is hurting with every breath that she's taking. It ain't hard if you put together all the facts. Be alarmed cause it's sounding a bit ominous. Don't be forced to just jump to one hypothesis, but be warned cause it's something that cannot be missed. Yeah.
PEs are tricky to find. It seems you'll never be right, but when it's not on your mind,
that's when you miss all of the signs.
Now here's Amy rolling into the ED. She gets an ECG. You see our BBB. Right heart can barely squeeze and she can barely breathe. What's next? What's next? You're thinking on your feet. Well, you're gonna get a well score. Amy scores above 4. Wait, her risk is higher. You know what that means. Don't get a D timer. X-rays normal, but you're playing with fire. You start to prime her for a stat CT. She's stable vitally. She's got perfect kidneys. So you wheel her down the halls to radiology. Gotta give her contrast right through the IV. You stare at the scene while you stare at the screen. What you see makes you scream and you're sitting there stunned. You look at Amy with the words right in your tongue. Now you gotta tell her she's got a blood clot in her lung.
But wait, you're not done. If her BP isn't stable, then heparin should be hung just as soon as you are able, and call down to IR while she's still on the table. Cause if nothing else is helping, then let's hope that TPA will give it right at the site. Try to do an embolectomy, it might save her life if you get it done successfully. Now breathe, it's time to consider how long to keep them on. But then if her first PE's provoked, you can give her a trial of 3 months. But if a blood clot comes back, or if there's active cancer, then stopping it early just isn't the answer.
PEs are tricky to find. It seems you'll never be right, but when it's not on your mind,
That's when you miss all of the signs.